Ever wondered what happens when the blood flow to your brain is disrupted? Well, the answer lies in the domain of cerebral circulatory disorders. These conditions, often complex and multifaceted, can result in a variety of symptoms from mild to severe and can even be life-threatening. Imagine a bustling city with roads, highways, and a complex network of transportation. Now consider the brain as that city and the blood vessels as the intricate transportation network. If there's a traffic jam or a roadblock, the entire city can be affected. Similarly, any disruption in the circulation within the brain can have serious repercussions, impacting the overall functioning of the brain. One of the most common cerebral circulatory disorders is the ischemic stroke. This happens when a blood vessel supplying blood to the brain becomes blocked or narrowed, much like a congested highway. It's often a result of blood clots or conditions such as atherosclerosis, which is the hardening of the arteries due to plaque buildup. Then there's the hemorrhagic stroke. This is when a blood vessel in the brain ruptures, causing bleeding into the surrounding tissue. This could be likened to a water main break, flooding the surrounding areas. Conditions like hypertension, aneurysms, or arteriovenous malformations can cause these strokes. Next on the list is the transient ischemic attack, or TIA. Often referred to as a mini-stroke, a TIA is a temporary disruption of blood flow to the brain, usually caused by a temporary blockage. Although TIAs typically resolve within a few minutes to hours and do not cause permanent brain damage, they can be a warning sign of an impending stroke. Cerebral atherosclerosis is another condition that involves the narrowing and hardening of the arteries in the brain due to the buildup of fatty deposits or plaque. This is akin to roads becoming narrow and rigid, restricting the smooth flow of traffic. Then there's cerebral vasculitis, an inflammation of the blood vessels, which can disrupt blood flow. This condition can be caused by autoimmune disorders, infections, or other inflammatory conditions. Finally, we have Moyamoya disease, a rare vascular disorder that involves the narrowing or blockage of the blood vessels at the base of the brain, leading to reduced blood flow. This can result in strokes, transient ischemic attacks, and other neurological symptoms. Treatment for these disorders is as varied as their causes. It can range from medications and lifestyle changes to surgical interventions or rehabilitation therapies. But remember, early detection and management are key in preventing complications and minimizing long-term damage to the brain. So the next time you ponder about what happens when the blood flow to your brain is disrupted, you'll have a clear picture of the possible scenarios. Cerebral circulatory disorders, though complex, are a significant part of understanding brain health and function. Understanding these conditions can help us stay vigilant and proactive in maintaining our brain health.